Hi guys, my name's Connor Dole and I'm here to talk to you today about epilepsy. So I'd like to start by telling you what epilepsy is. Epilepsy is a condition in which a person has repeated seizures. It is the fourth most common neurological disorder in the world, and it affects people of all ages. It is characterized by unpredictable seizures and can cause other health problems later in life. The brain is the source of epilepsy, even though the symptoms can affect any part of the body. Next, I would like to go on and talk to you about the cause of epilepsy. Epilepsy may be related to brain injury or family tendency, but most often the cause is completely unknown. Some people with no known cause of epilepsy may have a genetic form of epilepsy. There are around 12 different types of epilepsy, even though a bunch of sources go back and forth on specifically how many there actually are. Next, I would like to tell you about some facts regarding epilepsy. 65 million people around the world have epilepsy, and 3 million of those are in the United States. 1 in 26 people in the United States will develop epilepsy or some form of epilepsy at some point in their life, and 6 out of 10 of people, the cause is actually unknown. Despite its prevalence, the condition attracts little research and funding. This is due to the fact that there's been a long history of social stigma and fear around the whole disease. People used to think that you could contract it by just looking at a person. They also thought that once they went into a seizure, they were possessed by a demon or some type of ghost. So it really hurt the research community in actually trying to figure out how to cure it. And we still know very little about the human brain overall. So next I'd like to discuss some symptoms. The symptoms go very wide. There's a bunch of symptoms. To name a few, there's isolated sensory symptoms such as numbness, tingling, pain, or isolated motor symptoms, twitches, and obviously seizures. There's also psychic symptoms such as fear, sadness, elation, or laughing. Now I'm going to go into some prevention. There's no consistent methods on actually preventing epilepsy. It doesn't help that there's very few studies out there and going over what people can do to prevent it, but as of now, there's no method. Next, I'd like to go into some risk factors. Positive family history of epilepsy is one of the main factors overall. Brain injury, brain tumors, infections, stroke, and other diseases, and use of illegal drugs such as cocaine have found to elicit epilepsy. And that's just to name a few. Now I'm going to go into some treatment. Introduction to therapy as soon as possible is the best way in being able to manage this disease. Medications are next to be involved. Anticonvulsants are the main ones that are prescribed to you. Implantable devices, minimally invasive surgery. These two are pretty much only used if the anticonvulsants have no effect on you. The doctors will give it 2 different types of anticonvulsants, and if neither of the 2 work, then you will be given the opportunity to get a device or have surgery that could also help manage the disease. And there's also hormonal manipulation for women that have seizures that are related to hormones in the body that can bring on certain seizures. I'm going to talk to you a little bit about epilepsy and exercise. As of now, there's no restrictions to physical activity in people with controlled epilepsy, but they are told not to do things such as scuba diving, skydiving, and sports that have heights involved. But people with uncontrolled epilepsy should definitely take caution when exercising. They should always have someone with them. trainer or friend, just to make sure that they don't hurt themselves while they exercise. Also hypoxia, hyperhydration, hyperthermia, and hypoglycemia, as well as hyponatremia, are all linked to physical activity. Now, some of these may elicit seizures, but it hasn't been proven that they do for sure. Aerobic exercise seems to be safe, and it's one of the main things that doctors will tell you to do if you're epileptic, but it still may trigger seizures. So you just gotta be aware and be safe when you're exercising, because definitely for people who have uncontrolled epilepsy, they may not know when a seizure is going to come about. As for other people that are more controlled with their epilepsy, they'll be able to feel a seizure coming on or know in their body what it's like if they're going to have a seizure. But there's still not enough robust studies that have been carried out that talk about exercising and epilepsy due to the underfunding and under-research of the whole disease overall. Now for my case study, I chose a male, 50 years old, his height of 5'10", weight of 175 pounds, his BMI of 24.4, and his resting blood pressure of 146/98. He's also a non-smoker and lives an active lifestyle. Now, his resting blood pressure is high, and his age is also high, which are both risk factors, putting him in the moderate risk category. So for exercising, he should get medical clearance for exercising at high intensity, but for low and moderate intensity, he should be alright. His goals were to improve his cardiovascular endurance, his muscular strength, his flexibility, and improve his quality of life. So I would definitely recommend him doing a graded exercise test, such as the Bruce protocol or leg ergometer. And this would test for his VO2. I would also have him do a 1RM test that can also, this would test his muscular strength. I would have him do either a bench press or squat. But I would definitely frequently ask him how he was feeling, just to make sure that if a seizure was to come about, we would be ready and make sure he wasn't holding any weights and wasn't around anything that he could fall and injure himself on. For his exercise prescription, I would have him do aerobic exercise such as walking, running, or biking. Definitely wouldn't want him to be in a pool or anything, just in case he would have a seizure in the pool. Wouldn't want him to drown. I would definitely start him on moderate exercise, doing 30 minutes a day of 2 to 3 days a week at an intensity of 40 to 60% of his heart rate reserve, depending on his fatigue level. And then I would later work up to 4 to 5 days a week. Now, for resistance training, I would have him do free weights, machines, or just body weight. I would have him do this 2 to 3 days a week at an intensity of 60 to 80% of his 1RM, and have him do 2 to 3 sets of 10 reps, working all of his major muscle groups, but definitely being safe, making sure that he wouldn't drop any of the weights on himself, to injure himself. For flexibility, I would have him do dynamic or static stretching, or also yoga would be a good method. I would have him do this 3 to 5 days a week, making sure that he's holding his stretches for 30 seconds. Also making sure that he remembers to breathe and not to go past discomfort in between his stretches. In conclusion, although epilepsy is not curable, it is a manageable disease. Exercise is medicine. Even though there's not many studies out yet regarding this disease and exercise, it will definitely improve his quality of life. It will lower his body fat, it will build his muscle, and it will decrease the chances of him getting any other diseases later in life. That's all. Thank you for listening.